Hi everybody, this is Dr. Satish Pawar, your cancer surgeon, working in Care Hospitals, Hyderabad on behalf of Kaizen Oncology Network. Today let us talk about breast cancer awareness. So, this month October is well known as Pink October because it is to spread awareness about breast cancer. So, this since almost 1990 we have been this month has been designated as breast cancer awareness month. So, in this month generally there is awareness spread to the local population, to the general population about breast cancers. As soon as one hears the term cancer, there is a fear which goes through. So, early detection is the key to get rid of this cancer at an early stage and live longer. In this main component is there are around 3 components in early detection of breast cancer. First thing is the self breast examination. Self breast examination has gained a lot of importance because as soon as a lady detects the lump in her breast, this is the first sign or a first symptom that can lead to a diagnosis of breast cancer. So, self breast examination is done in 3 methods. First is to stand in front of a mirror and examine your own breast. So, this is done almost monthly at least once. So, how do you remember to do it is after your menstrual period is over in a premenopausal lady when menses are running, you after 5th or 6th day of your menses you can start examining your breast. At least this has to be done once a month and it hardly takes 5 minutes. It has to be done in standing posture, in sitting posture and in lying down posture. So, what you have to do is with flat 3 fingers you have to examine your breast. If you hold the breast then obviously you will feel that the breast is lumpy. So, to avoid any confusion you have to just examine with the flat of your fingers. Apart from that you have to examine your axilla as well. So, generally a lump starts in the breast and spreads to the axillary lymph nodes. So, that is where you need to feel these lumps and remember that it is very important to know this point is that these lumps are painless. So, until unless they grow in a very large size and there is infiltration of the skin, these breast lumps are generally painless. Other symptoms of apart from the breast lump is nipple discharge. Say for example, you have a blood through your nipple, that is bloody nipple discharge, or there is deviation, that means there is retraction of the nipple. What really happens is wherever the lump is, the nipple deviates towards the lump. So, there is retraction of the nipple, that means the nipple goes inside and there are changes in the areola as well, that is the surrounding part of the nipple. Apart from that, there is skin thickening, that means the skin becomes almost like an orange peel of an orange. And apart from that, there can be skin ulceration and fungation in very late stages. So, these are few things which you need to know, and there is always when you compare there is a contralateral breast to compare with. So, there are any changes. So, it is very important for you to know your own breast, feel your own breast, and if there are any changes, that say change in the size of the breast or appearance of any lumps in the breast is an important sign of early detection of breast cancer. That is the first thing. Second thing is to get it examined by any surgeon or your gynecologist who knows who has already examined your breast and can detect lumps which are smaller in size a person is a better person to detect breast cancer at an early stage. Apart from that is the mammogram. So, mammogram has to be done if you are at the age between 25 and 35. Generally, we suggest ultrasound rather than a mammogram because of the density, increased density in the breast. As you reach 40 and more, then we suggest a mammogram to be done along with the ultrasound of the breast. So, they go hand in hand. So, mammogram is nothing but an X-ray done particularly to the breast. So, due to improvisation and due to recent technology that is added to the mammogram, the digital mammography which is done, it can detect breast lumps, a smaller, very small in size as well. So, this mammogram we recommend in a postmenopausal lady, that is above 40 years, to be done yearly once, and before that at least once in 3 years. So, if there is a significant family history, say for example, there is breast cancer or ovarian cancer running in your family, then this mammogram has to be done from the age of 25. So, apart from that, if you go to the doctor, you will get more detailed information of when should you do MRI or is mammogram sufficient. So, depending on all this, you should take a call on getting your mammogram done or any test which can detect breast cancer early. Thank you very much.